The World Health Organization has lauded the Modi government's social and economic outreach during the lockdown period. Exclusively responding to India today at a Geneva conference, WHO Executive Director Mike Ryan said that India's economic relief package was an important move. Listen in.
My name is Ankit Kumar. I represent India today.
Yes, Ankit, please go ahead.
My question is, is the World Health Organization been tracking the developments in India? How will you comment on the progress made by India in the first week of lockdown, and how do you assess the results so far? Thank you.
I think it's a little early to assess the results of the lockdown, but I think we need to step back and assess the results of the response in general. Lockdowns and shutdowns are really should just be part of an overall comprehensive strategy. And what we need to be able to do as societies, and with the leadership of an all-of-government approach, is to be able to implement a consistent policy for a period of time, and then see where that takes us, and then measure and see what we need to do next. We need to be very careful not to knee-jerk. We need to be very careful not to be changing policies every single day, because people on the front line need certainty in their days. Communities need some certainty. So it's really important that we are very consistent in our communication with communities and our frontline workers about what we do. And we need to give clear messages about what we do for the next week or the next 2 weeks. And we need to then be clear when we're going to evaluate the impact of that period of intervention. And then if we have to change, we change, and we communicate that clearly. And then we do it again for another 2 or 3 weeks. And then we see how that works. And then we gather the information, and we consult with our frontline workers. And then if we have to adjust or change. This is about adapt, adjust, implement, measure. Do it again, and you just have to keep doing that over and over and over again until you control the disease. I would love to say that there's an easy way to do this. I would love to say that there's a way out of this without that kind of hard work, but there isn't. We have to be comprehensive. We have to measure everything we do. We have to measure at below the national level, and then if we have to use lockdown, if we have to use shutdowns, we do them as part of an overall comprehensive strategy. I would say India, and as the Director General has said in his speech, has made a really huge attempt to limit the impact of the shutdowns on the people who are most at risk and people who are most vulnerable in India, and that's a great thing to see. We see increase in testing. We're seeing an increase in surveillance, and we're seeing an investment in the healthcare system to be able to deal with more cases. But it is certainly too early for anyone to determine the impact of the shutdown or lockdown measures on disease transmission at this point.
With that exclusive conversation, we're slipping into a short break here on First Up. All the updates that you need to know on the coronavirus outbreak and on the lockdown in your city are up on our website, indiatoday.in. You can also download the India Today app for the latest headlines of the day. Remember, do stay home and stay safe.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.